Dr. Faye Bruce, these figures are just unbelievable, aren't they? Black women 4 times more likely to die in childbirth or afterwards than white women. Why? What's happening?
Yeah, no, it's crazy, but it's real. And in fact, years ago, the figures were worse, but we still have a huge problem with maternal mortality in black women. There are multifactorial reasons for this, and we don't see huge amounts of changes. We do need some real government action. So we do welcome the report, but there's so much more to do to change these figures and these experiences.
What would you like to see happen then? What would make a difference, bring the figures down?
Right, so in Greater Manchester, and we're really, really proud, the Caribbean and African Health Network has done a lot of work hearing women's voices, listening to the stories such as the one that's just been shared, which basically have directed how we shape services for black women and Asian women across Greater Manchester. So what we want to see is a national framework. We want to see national frameworks that are being implemented by local people, local community organisations that really...
I'm going to stop you there. National framework. What does that mean in terms of, you know, sort of the general public, individuals? Yeah.
So, for example, if we talk about the training for doctors and midwives, we want to see that there is culturally appropriate training that is designed on a national level and that is being implemented by local providers. So we need to see that. So what we tend to do is we tend to do things in local, small pockets, but actually we do need to have that recognition that culturally appropriate care is something that should be part and parcel of training for everybody that's working within maternity services.
And how accurate do you think these numbers are that we're talking about today?
I don't think that they're real true figures in terms of what we're actually seeing.
You think it's worse?
I think it's much worse. I think that the near misses are something that we really need to be taking into account. Those things that lead to people having those higher rates of mortality, what are we doing about that? And those are not being monitored in the way that we do need to, and we do need to put so many measures in place for that.